Good afternoon, everybody. This is our mic check. If you can see us, if you can hear us, go ahead and give us a thumbs up, and we will start promptly at 3 o'clock.
Good afternoon, everyone. Hope everyone's doing good today, enjoying this beautiful day outside. Got a lot to report today. We had quite a change since yesterday, and I'll go over this real quick report on our cleanup. It's going real smooth, real well. Billy and our people, and also the state's out today. Also, if you notice them, they've got some more trucks in here. They're picking up on state right away. And Billy and his crew's been working all morning. Of course, we're doing other things too, but he's got a group assigned to picking up brush. So keep trying to get that out there. We're going to try to do this probably. Maybe we can wind it up in another couple of weeks, hopefully. And as I've said before, our gates open down there from daylight to dark. If you're doing it yourself, cleaning up, you feel free to come on through and dump there brush. No debris, no house debris, just brush. That's on. We keep that gate open 7 days a week. Opening the businesses that have opened so far, as far as our restaurants and beauty salons, and I've not had any complaints at all from anyone. It seems like it's going pretty smooth. From what I understand, they're all going, strictly by the guidelines, and we appreciate that. And just that's what's going to take to make it work. Cloud and Canyon, as I said, it went smooth this weekend. They're still on the 150 cars, and then they shut the gate down and wait for a few hours and then open back up. That's working good. There again, if you see any violations that need to be reported, it's 1-844-442-2681, and from what I understand, they man that number 24 hours a day. So if you call and you see any kind of violations, anything that needs to be reported pertaining to this, the governor's order, you need to call. Now remember, April 30th, which I think it ends at midnight, I believe. That's just Thursday. That's when the shelter in place goes away. And from what I understand, I've not heard anything pertaining to him extending that at all. He has a right to do that, but as far as I know, that will end that. And that doesn't mean everything's over. It means it's to shelter in place. You still have the guidelines to go by, the 20 guidelines that will be in effect for a long time. Moving into our numbers, this is where the big last night we actually on the report we were 17 yesterday. We went up 17. Okay, then last night we had dropped to 14. Well, that was good, and from what they explained to us, that was either counties that was they actually not misplaced, but they actually, we were counted for other counties, and that was a mistake on the whether it be the health department or the state. But I got a call, or actually got an email less than 30 minutes ago. It's been about 35, 40 minutes ago, and this was from our regional health director, Dr. Vocchio, excuse me. Now, he is our regional health director from out of Rome. He's over all of our Northwest Georgia regional health departments. And Carey has questioned this several times. We both have looked at these numbers, and we tried to explain to you the last few days the difference in actually having a swab test and having a finger prick. Swab test is for people that have symptoms, and if it comes back positive, you know that you're walking with it. You got it, and you either quarantine or you go to the hospital. The blood test, the finger prick, it shows whether you've had it or it's in your system. And chances are, I mean, you've had it. Could have been months ago. Could have been back in December. Could have been January. In fact, most people that's come to me and said that they've had it and tested positive, they were sick in January or February, and they thought they had a real bad case of the flu. Well, up until now, they've counted these cases we found on our total numbers, and so this letter here, though, we got today, and this is fresh off the press, you might say. Through guidance from the CDC and FDA, the state epidemiology staff determined that serology-only cases should no longer be reported as confirmed cases in the data provided to the public. And what that is, that's the test that actually, when they prick your finger in your blood test. So all along, see, on our cases here, that's been counted in our cases. So in reality, if you look at Dade County, according to the Department of Public Health, and this is real numbers here, we had 11 of these cases out of 14, because we did drop to 14 from 17. And so that actually in reality showed us only having 3 real positive cases, which one was deceased. So in reality, we only have 2 today that are really real confirmed cases through the swabbing test. So that's really good news. I don't mean to let you guard down, but that's really big. The other cases that were here, yes, they were tested, but they were tested through the finger prick, which shows that these people here were sick months ago, possibly, and they're already back in, they here. So if you think about it, there's no telling how many people that we've got out there that even could be you or me, because I'll guarantee you when we get the test back where people are, because the one in Lafayette I told you was closed. I understood another one closed today because of lack of testing equipment or the kit. I want to be tested because I thought I had the flu this year too, in February, but hopefully that's what it was. But what I'm saying is, there's no telling how many people out there today that had sickness during the holidays or January, February, March, or whatever, that could have had this, because it affects different people differently. One of the ladies that had it, and she tested definitely positive. She didn't even have a fever. She was really sick, had a lot of lung problems, and she didn't even have a fever. So this is really brings our numbers to a good point. So in reality, we only have in Dade County, we only have 2 confirmed real cases right now through the swab. So that's good. Walker County, going to them, they dropped 44. They had 44 cases out of 58 that that it had the actual finger prick instead of the swab, and that dropped them down to 14. So they went from 58 confirmed to 14. Catoosa County, they stayed the same from yesterday, which was 46, but they actually had 23 people there, so that brought them down to 23. So it's big. This is really big news. I mean, honestly. Chattooga County, they stayed at 14. I mean, they went up one and actually from 13 to 14. Whitfield County, we don't have the actual printout on them right now, but anyway, Whitfield County went from 67 to 73, 81 to 82 in Gordon, 133 to 134 in Floyd, 288 to 296 in Bartow, and there's 604 still unconfirmed counties, unknown counties. Now we have in our region, our health region, all counties were affected by this except Bartow, Haralson, Paulding, and Polk. And from what I understand and from what I'm reading here, their cases were right at 100% with the swab. In other words, they're real as far as people actually showing positive. The others are real, but they're actually older cases from maybe weeks or months ago. So moving on down to Tennessee, Hamilton County, they had 141 yesterday. They're at 146. Marion County, they stayed the same. Grundy County, they stayed the same at 28. Sequatchie, they're at 5. They stayed the same. Midge County stayed the same at 6. Bradley County stayed at 45. Moving into Alabama, Jackson County, they stayed the same at 45. DeKalb County, they went from 71 to 75. Now we don't have any numbers. Of course, we're Georgia. This is Georgia Department of Public Health, and we don't know these other states really how that they're going to do this. The math on this as far as their other counties. We don't know how many of these may be the finger test or not. But this is big news for us, for all of our counties: Dade, Walker, Catoosa, Chattooga. So, Alex, you got anything? I just seen you. I'm sorry, slipped in here. Yeah. Okay, I did send you this right here, so it's pretty interesting to read, But we'll update you on anything else that comes across on this right here. But I feel a lot better. I'm not going to let my guard down. You don't need to let your guard down. But these numbers right here, this is the right way to do this, because Carey had questioned this several times about this. So you want to add anything on this, Carey, as far as
people are asking why the numbers are not going to go down. So I don't know about that.
Yeah, she can explain to you, because they flat said that they will not officially yet take these numbers away for whatever reason.
So as we received this letter earlier from Dr. Vocio, who is the health director of the Northwest District for the Georgia Department of Public Health, we decided to read you a few excerpts from the letter, thinking that it would help you understand what we now understand. And there have been a few of you already ask, why will those numbers not be removed? And we're going to talk about that in just a second. So this is directly from Dr. Vocio. He said, I want to tell you about a recent change to our reporting guidelines that might influence your understanding and trust of our data, particularly the confirmed case count. We will no longer include so-called serology-only positive cases in our COVID-19 case counts. What does this mean? Well, there are presently two primary but very different ways to test for COVID-19: diagnostic testing, which uses nasal swab samples to test for active infection, and serologic testing, which uses finger prick blood samples to test for previous infection. Until Friday, April 24th, Georgia Department of Health counted both PCR positives based on diagnostic testing and presumed antibody positives based on serologic testing as confirmed COVID-19 cases. Both have been reported in our COVID-19 daily status report under COVID-19 confirmed cases by county. However, based on guidance from the CDC and the FDA, our state epidemiology staff determined that serology-only cases should no longer be reported as confirmed cases in data provided to the public at this time. Listed below are our 6 counties who have serology-only cases included in their current cumulative case count, and that's Catoosa, Chattooga, Dade, Floyd, Walker, and Gordon. Please understand that your county case count will not be reduced because of this reporting change. We simply do not have the resources right now to go back and remove the serology-only cases. So they're saying at this point in time they're not going to be able to remove those cases, but they might in the future. They are looking at that, and they're going to let us know that, and if they do that, we'll let you know as well. He goes on to say, I'd also like to remind you that the confirmed case count at best represents only an incomplete snapshot of the spread of the virus in our communities. Because so many COVID-19 cases are asymptomatic or mild, never seek medical attention, and thus are not tested, we know there are many more people in our communities who have been infected with the virus than the confirmed case count indicates. Also, please understand that we expect to see county COVID-19 case counts continue to increase as testing increases. So those numbers will go up on the map that we put out every day. It will continue to say whatever the confirmed case count is. Today it's 14. Just know in your mind that you can subtract 11 from that, and we'll probably put a disclaimer on that map saying that those 11 serology tests can be pulled out to make it a little bit easier. So just know that. So right now we're pretty pleased. A lot of times you guys will come on and say, please have some good news for us today, and we feel like today is indeed one of those days when we have good news for you.
Thank you, Carey. Miss Jan. I'm sorry, Doctor. Our superintendent has some words of wisdom today, as always. And we're always glad to have her here. Yep, come on up here.
I'm just Jan. Thank you. Hello, everyone. Greetings from the Dade County Board of Education. I have some information about our meal delivery tomorrow. As we continue to recover from the COVID-19 closures and the recent tornado, we want to make certain that our students have adequate food to assist in their digital learning process and to stay healthy. We are expanding our service to include meals for 7 days. However, we are condensing the bus delivery and drive-through to 1 day each week, and that will be each Wednesday. Please remember that these meals are for all students and any children in Dade County ages 2 through 18. Students are encouraged to take the meals to support their digital learning as part of the regular school day, and these meals are at no cost to the parents or guardians. Receiving the meals actually helps the school district, so we want everyone to partake in this opportunity. In the meal bag this week, students will receive items that may be readily eaten or may require some preparation. A guide for preparation is included in the bag. Items may require immediate refrigeration and freezing. The bags contain a variety of lunch entrees, breads, breakfast items, veggies, fruits, and 2 half-gallons of milk, our students' favorite chocolate and traditional white milk. The Dade County buses will deliver on their usual routes and ask that students be present at their usual bus stops. Please provide a container where the bags can be placed, as we are continuing to practice social distancing as we deliver meals. Students that live on the following Trenton city streets will need to meet the bus at their normal bus stop location to receive meals due to using a larger bus. The smaller bus will no longer travel down these roads to make deliveries to individual homes, so please make certain you are at the normal pickup location 4 hours after regular bus time to receive meals. The 4 streets are Forest Street, Jones Trail, Poplar Streets, and Glenbrook Drive. Also, parents can pick up the meals at Davis and Dade Elementary tomorrow from 10 until 1. Now, I have a little bit of exciting news, Commissioner. Our county executive would be delighted to hear, and that is, today I was over at the middle school, and they're working on our 3D printer to provide some face masks. So we'll be for the county leaders, and we'll be sharing that later. And yesterday I said that we want to thrive, not just survive, and we have got so many exciting projects underway in Dade County. we're starting in a week over at the middle school to put in the remaining pieces for the remodeled Library Media Center, which I'm calling the living room of Dade County. It's going to be beautiful. And Mr. Rumley, I'd like to invite you and Mayor Case to host meetings over there anytime you want. It's going to be beautiful. And I can't wait for our students to see the living room that will be in the Library Media Center at Dade Middle School. Also, we have brand new LED lights at Dade Elementary, and they're putting in the LED lights at the middle school even as we speak, with a new roof and new air conditioner. And so we have a lot of exciting work. And the rock building, we're getting ready on that. We're cleaning out.
Davis.
Yes, sir, at Davis Elementary. And so we're working hard, and we're very excited. So, okay.
We do have a question for
All
you,
right.
Dr. Harris. Someone says, if your kids don't normally ride the bus, will the bus still stop?
It will. Yes, if your students don't normally ride the bus, they can still go out when the bus comes by, and the bus will stop for children aged 2 through 18. Thank you, Mr. Rumley.
Thank you. Thank you for being here. Just a couple more things. I know there'll be a lot of questions about this. Feel free to contact Carey or myself on my cell, because this is, like I said, we got this lesson 30 minutes ago, so probably you people out there watching are the first probably in Northwest Georgia anyway, probably the state, to have seen this and actually heard this. Because this is not something, from what I understand, that's just in Northwest Georgia. This is a statewide. That's why they mentioned they don't have the resources right now to change it, because if it was just in our few counties, it would be easy to do, you know. But that's probably, I imagine that's what he's talking about there as far as taking them all. And Alex and I, we're working on trying to did you contact Jim? Is that what you said? Yeah. And we're trying to actually find a supplier for these kits. They've got over 1,000 on the waiting list over at the other place there in Lafayette. I found out today. They're backlogged, you know, but they ran out of kits. And so I don't know just how scarce they are, but we're working and doing everything we can to try to bring a testing site here into the county somewhere, you know, close to us. And we'll keep you up on that. The sports complex, I wanted to mention that too, down to four fields. We call it 4 fields, but it's a lot more fields than that. But we're going to try to have that ready to go, so when all this is lifted, you know, in the next few weeks, months, whenever, that all the storm damage will be, you know, fixed and everything will be ready to get back as close to normal as possible. I did mention that our government offices and our court facility over there, we're going to go back to our open doors. That'll be on the Monday. It'll be the May the 4th. I'm sorry. And so there'll be some changes you'll notice, and inside as far as the way we do business and the way you do business, but they'll probably be that way for a long time. I mean, it's just here, and we're in a different time. We're going to after Friday, especially with, you know, the way things are going right now, we're going to actually go into probably 2 days a week on our report at 3 o'clock. We'll be here, of course, all the way until then. And we're going to actually not only report on our COVID or the virus, but we're going to keep these things going for a long time. And we're going to actually, this is a good way to stay in touch with you, with myself and Alex and the sheriff and everything. So we're going to actually start covering some really good stuff here, because we've really got a lot of people out there watching. I didn't realize, you know, that there was that many people that we could reach out to. This is going to be a really good thing from now on, and just kind of bear with us on. It's going to be kind of new for us, but we're going to be discussing a lot of important topics for the county. And like I told you, you know, when we started this right here, this is real stuff. These are real numbers, and we're not going to shoot you a bunch of bull. I'll just put it that way. This is going to be, you know, from, you know, anything that we say here, we're going to make sure that it's verified and you're listening to the truth, you know, the best that we know it, no matter what we're talking about. So We'll see you tomorrow. We'll be back here at 3 o'clock. Oh, yeah, okay.
And we need our census.
Yeah, I'm sorry. Go ahead. Yeah.
We will take questions and answers after this, or we will take questions and give answers after this because we do have a few. But I did want to remind you to go ahead and fill out your census online. And for our census moment, we've got a really neat fact. So go to www.2020census.gov. If you have already turned it in by mail, that's great. But if you haven't, go online. So today's census moment says that money to states and localities is a reason to fill out the census. Census totals help determine the amount of funding that state governments and local communities receive from the federal government for the next decade. You heard that right. So for the next decade is where that how long that money will last. So Census Bureau data were used to distribute more than $675 billion in federal funds to states and local communities for health, education, housing, and infrastructure programs during fiscal year 2015. Accurate census counts ensure that funding is equitably distributed for numerous programs such as Medicaid, highway planning and construction, special education grants to states, and the National School Lunch Program and Head Start. So please fill out your census today at www.2020census.gov. And we do have some questions.
Okay.
So our first question is about parks. Are the parks open currently? If not, when will they reopen? This is talking about Jenkins Park and the city park.
The walking track is all we have open right now until after this shelter in place is lifted and we evaluate. Of course, we got a lot of damage at our park. And until it's safe, you know, we'll keep it just to the walking track right now. That's the county facility. Alex.
Jenkins Park is open for the walking track and the picnic areas with the strict social distancing. The playgrounds are closed due to the touching and all the stuff of that until we get into the phases of open America for playground equipment.
We do know that we have some questions for Dr. Harris. She did have to leave. She's going to a grant meeting. But our next question is, why did the non-COVID cases go down from 17 to 14? Because last night we had reported there were 17 cases in Dade County, and then this morning they said there were 14.
That's right. And from what you understood and what we understood, that was actually other counties that were actually, we were counted, and our county was mistakenly counted for other counties in the state. You know, we even had one that Alex and I were trying to pinpoint yesterday, and it was actually an address in Dade County, Florida. You know, and we had gotten it came to us, you know, as Dade County. So that's the reason. That's yeah.
Okay. And then the last question I think is one you've already spoken to a little bit, but will videos stop after April 30th?
Well, what now?
Will these videos stop after April 30th? And I think you answered that a little bit already. Right?
No, we're going to maintain. We will stop daily. You know, we're going to do it like Tuesdays and Thursdays from now on. And I mean, you know, years to come. I hope it keeps going. But as far as the updates and Carey is 24/7. I mean, anything that changes, you know, she's going to shoot it to you on there. And if it's really critical or important, if it's midnight at night, we're going to come back on here. We're not only going to talk about this the viruses now from now, but this is really good for our weather people, for Alex. You know, we can instantly reach. You know, we're hitting 4,000, almost 5,000 people with this thing, and so that's big. So we will be here. This is a great way, a tool for us, not only for the virus, like I said, for a lot of things important to the county.
And then the last question we have is non-COVID related. This person would like to know who they could speak to about either lowering the speed limit on Back Valley Road or getting some speed bumps installed.
That's a good question. As always, when we actually even touch the speed limit in the county or change it, whether it goes up or down, the sheriff's department's involved in it. And if you'll leave her your number or whatever and give me a physical address, they have to look at it, they evaluate it, and we make the signs and post them, but we have to do that under the guidelines of the sheriff's department. Speed humps, there's not any roads in the state in our county that have county roads that have speed humps. We've had some lawsuits in the past, not in the county but in the state, that have been really class action type suits where people store their cars up. We have to really be careful when we're in the state of Georgia where you see speed humps. Usually when you see speed humps, it's in a regulated community like a subdivision that has their own little governing homeowners association or whatever. But I think if we do the speed limit signs and enforce it, that'll change that over there. Yeah. Okay. All right. Appreciate everyone watching today, and we'll be back tomorrow at 3 o'clock. And y'all have a safe day.